Okay, let's talk about what we do from this point forward. We've got our A and B. Well, if you're comfortable with how those two pieces cover your bills, you're not really required to get anything else. You're welcome to chug along with Part A and Part B if that is your preference. Another option is to get A and B, and then you get a supplement or a Medigap plan to cover your expenses along with a drug card for medications. And then finally, option number 3 is a Medicare Advantage plan, also known as Part C. Let's talk about the supplements for a second. So supplement and Medigap, those are interchangeable terms. What a Medigap does for you is covers the cost that original Medicare leaves you with. Note here, it does not cover any services that Medicare does not cover. Right? I get calls all the time and people say, hey, I've got to get a supplement so it covers what Medicare doesn't. Well, I want to be very clear here. What supplements do, what Medigaps do is covers the costs that we went over, those cost gaps that A and B leave you with. They do not really cover any services that Medicare itself does not cover. As a matter of fact, the way your bill is paid is the care or the service charge gets sent to original Medicare first. A and B decides if it's a Medicare covered service. If it is, then the supplement's going to have to pay it. If Medicare says, no, this is not a covered service, then your supplement cannot pay it. Right, one nice thing about this as an option is you do maintain the ability to go to any doctor, hospital, facility in the entire country. If they accept Medicare, they're going to be required to take your supplement, no matter who you have it with. Right, so very easy to use in that regard. There are a variety of these Medigap plans available, A, F, G, N, et cetera. This is what people sometimes call the alphabet soup. We'll look at these in a little more detail in a second. And then here you've got a very similar sign-up window to original Medicare. Most people are going to want these things to coincide and start on the same day. Now, one word about Medigap plans. Everybody's probably heard of the open enrollment window each year. So Medigap plans, supplement plans, they do not participate in any future open enrollment window, right? That's for drug cards and Advantage plans. So if you don't get a Medigap when you're first eligible, or you ever want to change your Medigap from one carrier to another or a different letter, there is no open enrollment window to do that. You will always have to, answer medical questions, be evaluated on a case-by-case basis, and the Medigap carrier will decide whether they want to accept coverage or not, right? So you just need a fairly clean health history if you ever want to do that. Going this route does have a higher monthly premium than the Medicare Advantage plans. Those are lower. Part of that reason is that the drug card is not included here. So you've got to go out and pick up a separate Part D drug card if you do want coverage for medication. When people go this route, there is typically very little out-of-pocket expenses for your medical costs, right? This is our grid of currently available supplements. It can look a little intimidating. I'm going to try to clean it up for you a little bit here. So let's start with getting an understanding of what was the most popular plan. It's that one in the middle called the Plan F. You can see historically why it was so well regarded. It's 100% coverage all the way down, basically. So every cost gap that A and B left you with, the Plan F covered at 100%. So it's a $0 deductible, zero copay plan. All right. It was a little too rich, and the government decided as of 2020 that they were going to retire that plan. So no new enrollees as of January 1, 2020. The gold standard now is this Plan G right next to it. Covers all your cost gaps that both A and B leave you with, except for the Part B deductible. And that is that $233 for the calendar year. So it's still very rich, very easy to use in terms of where you want to go. In terms of medical costs, $233 for the calendar year. The next most popular plan would be all the way over on the right, the Plan N. You can see that leaves you with an additional cost gap, which is the Part B excess charges. What that is, a doctor or facility can decide they're going to accept Medicare and then basically balance bill you up to 15% over Medicare's allowable rate. So if you have that plan, you kind of have unlimited risk exposure. I'm not sure what your total cap could be if you go use these doctors and providers that want to charge 15% more than Medicare allows. Unlimited risk exposure. As you move from the end, you'll just see more and more cost gaps that you will take on. So the plans will get less expensive by 20 or 30 bucks a month, but you will take on more and more cost gaps. All right, let's go over the drug card. We're still in that option, that route number 2. So we've got the supplement or the Medigap taking care of our medical care. Now we want a Part D drug card to help cover medication. So this goes along with your Medigap plan. There are lots of drug cards available. They're all very different. So while the supplements, Medigaps are kind of standardized, drug cards are not. They all have, various monthly premiums they're going to charge. All of them will have different formularies, which is the list of medications they're going to cover. Those medicines will be grouped into different tiers. Those tiers will have different copays, and all the drug cards will have, preferred pharmacy networks that they want you to stick to. One piece of good news about the drug card is that unlike the Medigaps, these do participate in open enrollment. So you can change those once a year, no medical questions asked. These plans are fairly sensitive to your zip code and county that you live in. Certainly, if you get one here in Virginia and you move to another state, you're going to lose that coverage and need to get a drug card based off the state you live in. The supplements, you do not have to worry about that. Okay. It's also possible you may get one, let's say you live here in the greater Richmond area, and then you're going to move to Roanoke. It could be a completely different set of drug cards available there. So again, just sensitive to where you live here. This next slide is going to make drug cards seem very confusing, and quite honestly, they can be. So there's various phases of coverage. There's a deductible, if applicable. Not all drug cards have them. Most of them do. There's the initial coverage phase, then the coverage gap, or what's popularly known as the donut hole, and then catastrophic coverage phase. Let's walk through these. So deductible, if your drug card has it, it may be as high as $480 this year. That limit is set by Medicare each year. But let's say your drug card had the deductible and you either met it or it didn't have a deductible. So you're past the deductible phase and now you're into the initial coverage phase. Well, this is what most people will associate with, I'm going to go to my CVS, pick up my $10 med. I go to Walgreens, get my $25 medication copay there, right? So you're relatively happy during this initial coverage phase. You're getting decent copays and coinsurances. Well, once the amount that you spend plus what the Part D drug card spends on your behalf totals $4,430 for the year, you are out of the initial coverage phase and into the donut hole, into this coverage gap. And what happens here? Your flat copays go away. So now you're paying a percentage of the cost, 25% for both brands and generics. So you've seen your costs go up while you're in this coverage gap. You're going to be in that coverage gap until you spend $7,050 out of your pocket, right? So to get into the donut hole, it's the amount that you spend plus what the Part D spends on your behalf. To get out of the donut hole, it's only the amount that you spend, $7,050 out of your pocket. But if you do hit that, now it's taken a lot of money to get there, but if you do spend that much in any calendar year, your costs go way back down. You're going to pay $9.95 for brands, or $3.95 for generic, or 5%, whatever's greater, right? But in any case, yes, you've spent a lot of money to get to there, but now your medications will go down significantly. All right, so that made drug cards sound a little confusing. And like I said, they are. I'm going to try to make it a little bit simpler for you here. So there's an excellent tool on Medicare.gov itself that will allow you to enter your actual medication list, enter the pharmacy you want to go to, searches all the drug cards, and will make recommendations based off of your situation. We have some additional tools we use as brokers as well. So we can do that for you. Search all the drug cards, find out the right one for you. And then it gives us the ability to project what your medication is going to be, what those monthly charges are, at least for the medications we know about. So we can enable you to accurately project your medication costs so you can do some budgeting. Again, at least on the meds we know about. And then remember, we can always change the drug card year to year as your needs change.